Hello, everyone. Good afternoon. Before we get started with this next session, I'm going to ask that any questions you might have during this session, please enter them into the session chat box, and we will address them at the end of this session. And I want to say thanks to all of you for joining us today, and thank you to Preferred Assisted Living for sponsoring this breakout session. My name is Beth Hamilton. I'm the Northeast Regional Manager with the Alzheimer's Association, and it is my distinct pleasure to introduce to you our Public Policy Director, Tommy Hernandez. Tommy, take it away.
Yes, thank you so much, Beth, for that kind introduction. And again, thank you to our sponsor as well for helping make this lunch session happen. We've had a great program so far, and I've been looking forward to this all day. I feel like we've been getting a lot of I guess just general inquiry, people asking how they can get involved with advocacy. So I thought, what better time than the Caregiver Conference when so many things are happening in our government affairs, in our advocacy at the state level, at the federal level, just all of the buzz just this week alone with it being election week. So I thought this was just a great time for me to come on and discuss Advocacy 101 with you. So I look forward to the next 30 minutes. And again, thank you to Beth for the introduction. I'll go ahead and get things started here, guys. So I have a PowerPoint presentation. It's got about 10 slides. So I'm going to ask before I click the share screen on that if you experience any type of technical difficulties, or if I am not coming through, just go ahead and please put that in the chat, and we're going to work through that as quickly as we can to resolve any technical issues you guys may be experiencing. But just know that we have worked very hard to really get this thing down in a way that we feel we can mitigate any of those technical issues. So getting started, like I said, today is going to be Advocacy 101. So let me go and click on the share screen, and we'll go and get started, guys. So before we begin to talk about advocacy, we first need to talk about public policy. And I think many of you may be familiar with that word public policy because what it really does is it describes, it's like the umbrella work. It's the umbrella term for everything we do. When we work in one of the following arenas: grassroots advocacy, government affairs, public policy development, we are working in the arena of public policy. Now, my title here at the New Mexico chapter is Public Policy Director, because that really encompasses everything I do, including the government affairs, means working with our elected leaders, working with those people who are appointed as policymakers in our Department of Health, in our Aging and Long-Term Services Department, and many other related agencies and departments within our state government. Policy development, that's me working with our elected leaders to really craft bills that may get introduced during a legislative session. Or maybe I'm working with policymakers to determine what rules and regulations need to be modernized, need to be updated, need to be reformed. So just to be clear, when you hear me use the word public policy, just know that I'm using it in the sense of it being an umbrella term, as in everything we do. Again, grassroots advocacy, government affairs, policy development, and all of that stuff is the umbrella term for public policy. On the right side of your screen, you see that I have text AIM, AIM, to 52886. Now, this is going to be found on each one of your slides. And the reason why is because that short code, when you text AIM to 52886 using, of course, your mobile device, that will capture your information. It signals to our program that you are interested in becoming an advocate, and that information will eventually pass its way down to me, and that'll allow me to connect with you. So I encourage you guys, as you learn more from my presentation today, if you become interested in getting involved, want to learn the many ways you can get involved, just text AIM to 52886. So you will see that on each one of the slides of the presentation. Let's go ahead and move on. So Advocacy 101. Broadly, advocacy is the coordination of volunteers united behind a single cause. At the association, grassroots advocacy mobilizes a wide network of volunteers to advocate for public policy changes to their elected leaders. Now, our single cause here at the Alzheimer's Association is one thing. I think many of you are already familiar with it, but for those of you that are not, that is to end Alzheimer's. That is our single cause, end Alzheimer's, and it's found in our common hashtag that you see in all of our social media posts, #EndAlz. So how do we advocate? What are the two programs? Well, The first one I'm going to cover today, as you see on your slide, is the State Champions Program. This is the backbone of our grassroots advocacy efforts for state government, meaning the policymakers and the elected leaders. So State Champions specifically refers to that state level grassroots advocacy program. Now, the Advocacy Congressional Team, also referred to as ACT or ACT rather, this is the program for our federal advocacy. It involves advocacy reaching out to our United States senators, which we know every single state here in the US has 2 of them. And then our members of Congress, our United States representatives, which we know there are 3 of them here in New Mexico. And 2 of them, which are going to be new representatives to the delegation. We're very excited to have 2 really robust programs. One of them, again, being for the state government level, the State Champions, and the second being the Advocacy Congressional Team. So today, with it being the New Mexico Caregiver Conference, we're going to go and focus a little more on State Champions. So simply put, the journey to end Alzheimer's runs through state capitals. It doesn't only run through Congress. It does not only run through Washington, D.C. While the Alzheimer's Association has long provided cost-free resources to families, we understand that state governments can and need to do more to meet the growing prevalence of the disease and the burden that is following it. This is where the important role of state champions comes in. State champions, they engage with their state legislators to help pass legislation that would help people with Alzheimer's and their caregivers. State champions are the voice of the 33,000 plus people living with Alzheimer's and the 108,000 caregivers. So again, our state champions, these people are really making the necessary action that we need in our state capital, also known as the Roundhouse. Moving forward, I want to go ahead and introduce to you guys State Representative Marion Matthews. Now, Marion Matthews was just reelected to House District 27, and maybe some of you are represented by State Representative Marion Matthews in the Roundhouse for our Albuquerque office, which is located just west of Wyoming on Academy. Our office falls in her district, and she also happens to be a member of the Health and Human Services Committee. Now, that's an important note before I play the video, because many of the types of bills that we are monitoring, perhaps bills that we are having proposed on our behalf, these bills get very closely vetted and examined and debated in the Health and Human Services Committee. Often it's the first hurdle that any one of our pieces of legislation needs to clear. So I'm going to go ahead and play the video, and what it's going to do is it's going to show you a legislator's perspective on the importance of advocacy.
Hi, I'm State Representative Marion Matthews, and I thank you so much for the opportunity to share my perspective as a state legislator on the importance of advocacy and the impact it can have in the Roundhouse. Advocacy helps legislators understand which bills are important to constituents. Because of that, your advocacy, first of all, helps us identify our legislative priorities. Secondly, it helps us make a better informed vote. Third, it helps us decide how to vote to best represent our constituents. And fourth, if we don't support or vote how you would like us to, it keeps the dialogue open so we can find a compromise that works for both of us. Hearing directly from the people we represent has a significant impact on how far a bill may get during the legislative session. Bills that pass the legislature have a strong advocacy network behind them. The prevalence of Alzheimer's and other forms of dementia is rising across the state. Legislators may be able to help tackle the large burden this is creating. When we hear directly from you, you help us understand its impact on real people, real New Mexicans like yourselves. I encourage you to get involved with the Alzheimer's Association's advocacy program called State Champions and make your voice heard in the Roundhouse. If you do that, we will hear you. Thank you so much.
So what we heard in that video was that State Representative Marion Matthews, again, a member of the Health and Human Services Committee, explaining to us, you as potential advocates, I hope, how important it is for advocacy to help get these bills across. Without advocacy, with only my presence in the roundhouse, that simply is not enough. What makes the Alzheimer's Association so strong in every state across the country is that behind every public policy director, behind every piece of legislation that is introduced, there is a robust network of advocates. Now, I think we all understand right now that everything really has gone virtual. In past sessions, we were able to mobilize advocates truly on a floor by floor level. This year, we know that things are going to look very different. We know that most of our advocacy is going to be communicated directly through email, through text messaging, through phone calls. And I can assure you that the Alzheimer's Association has evaluated some of the challenges that we expect to see, and we have planned to mitigate those challenges. One of those is that we have invested in new tools that make it extremely easy for our advocates to get their voice heard, to reach out and connect with their state legislator. So I just want to remind everybody out there that we certainly have made all of the efforts we possibly can to ensure that any advocacy that needs to happen during this upcoming session, which it will be a 60-day session, we know that we are ready to mobilize our advocates in the digital space. So again, we're very excited. I want to encourage everybody to take advantage of that short code of 52886. You just text AIM to 52886. That is the simplest way for you to get on track for me to connect with you at a future time and remind you how you can get involved, because again, there are many, many ways to get involved as an advocate. So again, I want to take everybody, ask everybody rather to take advantage of that short code, the 52886. Let's go ahead and move on to the next slide. So now we've talked a little bit about advocacy. You understand what advocacy is, why it's important, and how it falls under the general umbrella of public policy. Next, I want to talk about what are the public policy priorities in the states. Now, the public policy priorities that you are seeing on your screen here, and I'm going to go over them, these are the same public policy priorities for every single chapter across the footprint of the Alzheimer's Association. We are all working towards establishing these 4 goals and finding significant successes in executing on these 4 goals. Now, these goals, we arrived at these goals rather through many forms of research, through many discussions to understand what are the most significant pieces of the pie here. When we talk about addressing Alzheimer's disease and dementia across the states, we were able to narrow it down to these 4. The first one, and again, I want to note that these are in an order of priority. Goal number 1 of our public policy priorities in the states is to increase awareness, early detection, and diagnosis. That is extremely important because we know that we need to educate healthcare providers about the early detection and diagnosis. We need to conduct culturally appropriate public awareness campaigns and early detection and diagnosis, especially true here in New Mexico when we have a very culturally diverse population here in our state. We are blessed to have diversity where we have heavy Hispanic populations, Spanish-speaking populations, Native American communities. So we know that this conducting culturally appropriate public awareness campaigns on early detection and diagnosis is absolutely important here in our state. We also need to include messages about brain health and risk reduction in existing public health campaigns. Another thing we can do to address goal number 1 is to collect data on Alzheimer's disease, cognitive decline, and caregiving to inform future policy decisions. We know that more and more state legislatures are finding that data-driven decisions are the best way forward. And that's exactly why we also place an emphasis on collecting that data statewide. And we do that through a very special survey called the Behavioral Risk Factor Surveillance Survey, which I just recently made a presentation to the Department of Health on, asking that the Alzheimer's Association include its questions specifically related to caregiving in the 2021 statewide survey. So we look forward to their response. We feel very confident that once again, as it has been in years past, they will find that it is absolutely necessary to include our caregiving module in the 2021 survey. Moving on to goal number 2, build a dementia-capable workforce. Well, we know that here in New Mexico, there often is a very insufficient network of dementia-capable workforce. So we certainly need to address that in our state. How do we do that? Well, we can create incentives and career pathways to recruit and retrain these professionals. Healthcare professionals, that would mean in gerontology, geriatrics, dementia care, geriatric nurses, for example. We also can require a competency-based dementia training for all staff involved in the delivery of care across all settings. I want to stop right there and talk a little bit more about that, because that is one point of note here, that in the next legislative session, we're going to closely be reviewing what the rules and regulations and the licensing is in all of those who are involved in the delivery of care workforce, to make sure that all of the training is adequate and it is modernized for all of the new research and all of the many things that we now know. So we want to make sure that we are also requiring training for adult protective service workers and law enforcement on effective intervention in cases involving individual with cognitive impairment. Goal number 3, increase access to home and community-based services. Again, also a very important point of note here, because we know that in New Mexico, it still very much is a frontier state, and many parts of our state still are insufficiently supplied with broadband service, with many amenities that more populated areas have. So many of these caregivers in the rural parts and even semi-rural parts of our state, they certainly need an increase in access to home and community-based services. So what does that look like? What does increasing access to home and community-based services looks like? Well, we need to access people with dementia regardless of age or financial status. I really want to go and underscore the point there on age and financial status, because we know that when it comes to home and community-based services, there often are age minimum requirements and there are income-based requirements. We want to make sure that regardless of somebody's age, regardless of their income, that they have access to the home and community-based services that they need to ensure that if they choose to age in place, they can do so, so long that it is in a safe environment for them and they have the supports, they have the systems, they have the programs to help them do so, and for their caregivers as well. So moving forward, we can also provide Medicaid coverage for person-centered, dementia-competent, and dementia-specific care across care settings. So another thing we're going to be looking at is we're going to be looking to update Medicaid eligibility requirements to allow those with dementia to live in the most appropriate setting. Again, that also is equally important here in New Mexico, because we know many of the people who have Alzheimer's dementia, they do end up on both Medicare and Medicaid. So we want to make sure that all of those eligibility requirements are meeting the needs that they absolutely have. So we're going to be paying very close attention to updating those Medicaid eligibility requirements to allow those with dementia to continue to live in the most appropriate setting for them. Last, which is goal number 4, is to enhance the quality of care in residential settings. Now, this is very important, especially as we right now are going together through this pandemic. We know that people with Alzheimer's dementia in residential settings faced all new challenges. The burden grew far heavier for them and for the caregivers as well, who were deeply concerned about the level of care and the quality of care that their loved ones were receiving in these residential settings. So again, what does goal number 4 translate to in action? What are we asking for at the policy level? Well, we want to make sure that we are protecting people with dementia who have behavioral issues from being improperly displaced from residential settings. So what does that mean, improperly displaced? Well, what that means is that if someone who has Alzheimer's dementia, because we know that sudden mood swings can be associated with this disease, we want to make sure that any residential setting that they are in, that they are not being improperly moved out of that residential setting. So we want to ensure that they continue to receive that residential setting, again, so long that it is safe to them and to the others, who may be residing with them in that setting. Moving on, what's another example of enhancing quality care residential settings? Well, we want to ensure adequate and fair Medicaid reimbursements for nursing homes. I've heard from many operators and owners and administrators in residential setting cares that the Medicaid reimbursement rates simply are too low to meet what their business needs are to continue to offer people with Alzheimer's and dementia care that safe setting that they may need in the form of a residential care setting. So we want to make sure that those Medicaid reimbursement rates, that they are aligned, that they are adequate, that they are sufficient, and that they are, most importantly, that they are fair to allow our residential setting owners, operators, to to continue to offer the quality of care that people with Alzheimer's dementia need. Let's go and move on to the next slide. So at this point, we're going to talk about recent achievements, right? The Alzheimer's Association at the federal level has had milestone achievements. Year over year over year, we have increased the level of funding that is going to the National Institutes of Health. We have improved the quality of care. We have provided funding for critical campaigns to educate clinicians and practitioners. Now, we've taken a lot of what we've learned about how to be successful through our advocacy grassroots programs and brought it to the state level. So again, that's how it ties together with the state champions. So with that, what successes have we achieved in the short span of time since launching the state champions program in 2019? Well, in its inaugural year, launched by every chapter across, I'm happy to report out to you that in 2019, the very first year of the state champions program launched, we were able to introduce a bill known as Senate Bill 42 in the 2009 legislative session. And what that bill did was it modernized the Silver Alert notification system. Now, for many of you are already familiar with the Silver Alert, what that is typically it is a public service announcement. It is an emergency notification to find somebody who may have gone missing. And before, there was an age requirement. I believe the age requirement was 60 and older to be eligible for the Silver Alert notification system. Well, we also realized that no data was being collected on the number of Silver Alerts that were going out. Useful data such as where are they living? Was the person who the alert went out for, were they found safe? Were they found injured? Or worst of all, were they found deceased or not found at all? We know that data-driven decisions are going to help advance our public policy. So we wanted to make sure that we included several key pieces to modernize our Silver Alert notification system. Foremost, it eliminated the minimum age requirement. Any person who has any form of cognitive decline is now eligible for a Silver Alert. This is important because we know now that more and more people are being diagnosed with early onset Alzheimer's. 65 and older is typically the age that we see people begin to develop the early signs and symptoms of Alzheimer's, but that is not always the case. We have heard instances of people as young as 40, as young as 50 who are beginning to develop early onset Alzheimer's, and we are unfamiliar or unaware rather of what progression is going to look like per individual. So we felt this was an important piece of this legislation was to remove that minimum age requirement. Another point made in the modernization of Senate Bill 42 on the Silver Alert was that we wanted to ensure that the Department of Public Safety was keeping that data. So whenever a Silver Alert would go out, has gone out, we now can ask for that data to determine where are we seeing more and more of these Silver Alerts go out? Is there certain trends that we need to be watchful of? How can we always be improving it? And we take that approach of always improving it by examining and evaluating the data. So those are just two things of the Silver Alert modernization bill that we enacted in 2019. And I'll go and leave on the Silver Alert bill with saying that not only did this bill pass at a rate, both chambers of our state legislature, at a rate far faster than many of the other bills, but it was actually almost immediately signed when it reached the governor's desk. If I'm remembering, it was the 50th bill signed by the governor. This is a testament, again, to our state champions program. It is a testament and a demonstration of our robust advocacy. Even in its inaugural year, we were able to get this bill through the House of Representatives, through the upper Senate chamber, and signed by the governor without a single vote of opposition. Talk about a true legislative win through bipartisanship. Well, I'm very proud to say that Senate Bill 42 in 2019 completely captured all of those things. So moving into 2020, still this year. Well, earlier this year, when the legislative session kicked off, which was a 30-day session, we knew immediately that the clock was going to be against us. Our cause is always true and it always receives the attention from our legislators. But we know that running this bill of this magnitude in a 30-day session was going to require, again, a very dedicated and robust and well-coordinated form of advocacy through our state champions program. So what I'm talking about now is House Bill 225. also known as the Kiki Saavedra Senior Dignity Fund. For those of you who participated in the opening ceremony this morning, you heard Governor Michelle Lujan Grisham cover some key things about the Kiki Saavedra Senior Dignity Fund. And it's because that we were called on with our partners at AARP to really put the legwork in as far as advocacy to help this bill beat the clock and get through and get onto her desk. So we're happy to say that it did beat the clock, it did get passed, it did get signed into law. So what does it do? What does it mean for caregivers? What does it mean for people in rural parts in particular? Well, as an overview, it delivered a milestone investment in improving and delivering high priority services for seniors all across New Mexico. So to get a little bit more into what those high priority services are, one being mobile daycare pilots. In order to allow caregivers in rural counties respite from their full-time caregiving responsibilities for persons with Alzheimer's and dementia and other debilitating conditions. Two, expansion of traditional adult daycare. We want to build out adult daycare with the goal of implementing best practice models and other self-sustaining models through sources such as Medicaid and other federal funding. Also, what it does is increased in-home caregiving services statewide. Another way to think about that is it promotes intergenerational volunteers to provide in-home care, training and mentoring of existing volunteers or existing caregivers to ensure quality of care. Grandparents raising children. Now, this is a rising topic in our state, so we're very happy that this next topic also was included in the Senior Dignity Fund. Multi-generational centers within current senior centers that would include case managers that provide personalized assistance, family activities, parenting education workshops, emergency assistance with utilities, family meal support groups for caregivers. All of these things can be found at a multi-generational center. Funding innovative programming that assists in improving social determinants of health, including addressing socioeconomic status, food insecurities, and education. And lastly, another thing included in the funding package of this bill was short-term funding for care transitions, addressing food insecurities, transportation, and respite care. This bill was a very heavy lift, but again, I'm very happy to say that we were successful. We met the challenge and we succeeded. We overcame that and we were able to get this bill through and get it onto the governor's desk where it was enacted. So a key component of our advocacy day is when we have, a key component of our state champions program rather is our Alzheimer's Advocacy Day. During the legislative session, I work with the state legislature staff to give us one day where we all convene, advocates from all four corners of our state, where we convene in the rotunda area of the roundhouse, and we bring together a slate of speakers, a slate of advocates, and we come together and unified as one, we are able to bring an ultimate form of awareness and concern for the growing prevalence of Alzheimer's and dementia in our state. Now, in the last 2 years under Governor Michelle Lujan's leadership, she has accepted our invitation to invite our advocates to meet with her in her cabinet room. So the picture you're seeing on your screen was from the most recent advocacy day. I believe it was on February 5th. And this room here was filled with advocates, with members of our board, with other elected leaders, as you may see in the picture. And the point I'm trying to make with this picture here is that Alzheimer's disease brings a robust, Alzheimer's Champions program rather, brings a robust advocacy, not just from grassroots advocates, but also from our fellow legislators, people who are also members of our community, who may have also been affected by Alzheimer's disease. They show up as advocates and they show up as state legislators. So we were very proud that day to have, I believe it was over 60 people in the cabinet room with the governor, where we got to advocate and make it clear to her that the disease and the prevalence and the burden is growing in our state. And it is time that our state policymakers, our elected leaders, step up to do more to provide the key critical services, programs, and supports that caregivers like many of you need and rely on. So again, that was such a significant moment, and perhaps many of you who are on the call, some of you on the call may have been in this picture. And if you are, then again, I thank you so much. It was such a wonderful day. And we look forward to sometime in the future, which we obviously do not know when once again, we can return to the governor's office to again, have a great productive meeting, a meaningful meeting with our advocates and with her in her cabinet room. So that was a monumental day, and I'm glad we were able to have that, of course, before the pandemic struck our state. So I just wanted to show that as an example of how powerful and how credible our state champions program is. So questions and comments. Up on the screen now, you see my name, you have my title, and you have my email address. So I want to encourage everybody out there to reach out to me. Let me know how I can help you become an advocate, what we're going to be looking at in the next session. And I look forward to hearing from you. Thank you so much. I'm so thankful to have your time today, and I hope you enjoy the rest of the programming. Thank you so much.
Tommy, we have a few questions that have come in during your session.
I have the time.
All right. So Michelle Rains asks if there's going to be an advocacy day this year for the Alzheimer's Advocacy Day in 2021 during the session. Do you know that? Do you have an answer to that yet?
Thanks for reading that question, Beth. And Michelle, hi. It's so great to know that you are with us. I know it's been some time since we had a chance to speak. Michelle, to answer your question, I am in the process right now working with the governor's office to organize a virtual advocacy day. I wish I could say for certain that we are guaranteed to have one, but at this point, I think if anything is certain is that nothing is certain. But just know, Michelle, and to the other people out there, I am working as quickly as I can to get an answer on when and where and how we will have a virtual meeting with the governor, just to continue our tradition of an advocacy day meeting with the governor. Thank you.
There's another question. Michelle's come up with a lot of great questions, and I'm really grateful, Michelle, for your questions. ESLs and LEPs, patients, residents, family, and caregivers need equal access to information. Will any of this be available in Spanish or any other languages?
Again, Michelle, fantastic question. As you may have heard me earlier in my presentation, that what makes New Mexico a uniquely great state is that we are culturally rich. We are diversely rich. And in our goal number 1 of our public policy priorities, which is to increase public awareness for early detection and diagnosis, again, I believe it was a second bullet point, but just to reiterate, it was to conduct culturally appropriate public awareness campaigns on early detection and diagnosis. And how we would do that, Michelle, is that we would be advocating for the Department of Health to dedicate some of its funding to promote awareness, to promote early detection, the importance of an early diagnosis in Spanish, in Native American languages, and the things that just, all of the different populations that are found within the borders of our great state. So yes, certainly looking forward to delivering that content, that education, that awareness, to make sure that we are reaching all populations. Thank you.
Another question from Michelle is, when will the Medicaid eligibility requirements be updated? And then the second part of the question is, how do we get involved in this endeavor?
Medicaid is such a hot button issue in our state. My understanding is that later this year, possibly this summer, at this point in time, Medicaid may be looking for public comment. Our rules and regulators will be looking to take comment for proposed changes to the eligibility requirements. Michelle, this is such a long form answer to your question. I'll go and connect with you offline, Michelle, and we'll go and talk a little bit more about this.
Yeah, that kind of segues into her last question, Tommy, which is great that you're going to call her. How do we get involved to become an advocate or state champion?
Well, I want to go ahead and tell everybody to just text AIM, AIM, text exactly that AIM to 52886. So again, in the body of your text message, you're going to have AIM, and the number you are texting AIM to is 52886. That will automatically generate a link back via text message, and you just go and follow the instructions on your phone. That is the simplest way to get involved with our advocacy. All that information comes right to me, and I'm able to follow up moving forward. So we wanted to make sure we streamline the process. You have my email on the screen. If you want to reach out to me directly, of course, do not hesitate to do so if that's what you'd like. But if you just want to learn more about our advocacy, text AIM to 52886.
I think that was the last question that came in, Tommy. If anyone else has another question, we still have a couple of minutes. So far, nothing's coming in, Tommy.
All right. Well, I guess we'll go and conclude the lunch session. Once again, my sincere gratitude to all of you who tuned in to this Advocacy 101 presentation. Thank you so much for continuing to be engaged. I know that we are going through so much right now, but we are all in this together, as we've heard time and time again, and we will continue to go through this together. But just know that we are working to advance addressing Alzheimer's and other forms of dementia by public policy in the state, and that will not stop.
Thanks for attending, everyone.